Hey everyone, welcome back to FU Cancer. Joining us on today's live stream is board certified oncology clinical specialist, Dr. Andrew Chongaway, here to talk with us about exercise rehabilitation and how it relates to cancer care. Dr. Chongaway joins us from the Allegheny Health System in Pittsburgh, Pennsylvania, where he works in their outpatient oncology rehab program. He graduated from the University of New England with a doctorate in physical therapy and holds certifications as a certified exercise physiologist and cancer exercise specialist through the American College of Sports Medicine. He also holds a vestibular certification through the American Institute of Balance. Aside from working in the clinical space, Dr. Chongaway has also presented on topics in oncology rehab and exercise at state and national conferences and is a contributor to the well-known textbook Oncology Rehabilitation, a comprehensive guidebook for clinicians. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. So how does exercise rehabilitation differ for individuals with cancer compared to those without?
That's always a good question. And, patients are always asking me like, hey, what's it going to be like here? And I think really the biggest difference is that it matches where they're at relative to their treatment program or their schedule. So, I see patients that are just starting up with neoadjuvant care, and they're technically in this prehabilitation stage where we're really trying to optimize their function and their capacity prior to surgery. And then I see people all the way through, for unfortunately towards where they're on palliative care and more end of life stuff, where we're really just trying to maintain their function and their independence in the home as long as we can. And it really, I always say it matters, what their goals are and really where they're at. So patients come in, if they're getting treatment every 2 weeks, every 3 weeks, I'm like, well, maybe we see you once a week, twice a week on those off weeks, and then maybe we see how you do on your on week. And if you can make it in, you can make it in. If you can't, so it's really not necessarily a whole lot different. A lot of my sessions look like somebody that you might see when you walk into a gym, working with a personal trainer. But it's just being cognizant of what their treatment schedule is like and any other potential comorbidities that they have that might affect their performance that way.
And what range of mobility levels and abilities do you typically encounter in your rehab practice?
Fortunately for me, it is, very widespread. I have backgrounds in working within acute care, inpatient rehab, and outpatient settings, having gone through the residency at Beaumont Health, now Corewell Health in Michigan, which kind of set me up to be very comfortable with working with really anybody across the care continuum, depending on their mobility. So, I have patients currently right now that they are unfortunately able to stand up on their own, but we're working towards that. And we're working towards getting them back to being independent with their mobility, their ability to walk. And then I have patients that come strolling in, ready to rock and roll, that are, looking to sweat, get their heart rate up and feel like they got a solid workout in. The one thing I do like about that is it kind of lets me use all of my skills, and really be able to, have an impact across the whole care continuum with anybody that way too. Just because we know the individuals that have poor mobility status or aren't able to walk but are really hoping to get back to that point, they really can benefit from rehabilitation services. But at the same token too, we also know that having a healthy lifestyle modification changes, and really becoming active and getting back to the things that they really enjoy doing also has a benefit for their quality of life function and chance of reducing risk of recurrence or developing a secondary cancer that way too.
So what are some common mistakes that you see being made by individuals who are recovering, really when it comes to rehabilitation?
Um, I don't really I don't really know if I see like have mistakes. I think there's a lot of individuals that don't necessarily that are given a lot of information or can find a lot of information, and they're not sure if it's credible, and they're kind of concerned with what's going, what they can do, what's safe at what point. And, there's not necessarily always guidance. The big thing is, that patients come in and they say, oh yeah, I was just told to walk after surgery, or, I need to really, let myself heal. But at the same token, I feel myself getting weaker, but every day I just sit on the couch and heal and don't feel like I can get back to doing what I want to do when the time comes. And I'm like, that's very valid. You just had major surgery. Like I have patients that have a huge surgical scar from their bottom of their sternum to the top of their pelvis, pubic bone. And they're like, what is safe for me? Can I lift? Can I carry things? And I'm like, well, let's see, how your body is. And also let's look at how far out from surgery you are. So I think there's a lot of just uncertainty. And that is one of my biggest things, is showing that they can really do anything they want to do. Maybe we have to modify it to start, but 3, 4, 5 weeks down the road, depending on where they're at, they can get back to doing whatever they really want to do, hopefully, that way.
And I think exercise, especially you mentioned after surgery, I think exercise after recovery is scary in some aspects because, normal exercise can hurt, right? Like I go to
Yeah.
the gym, I go for a long walk, I'm uncomfortable afterwards. So where do you draw the line of I'm uncomfortable because this is normal exercise patterns, or I'm uncomfortable because something's wrong, or I push too hard?
Yeah. So that is like very big education point that I talk about a lot of times too. And I really try and emphasize, hey, if something's not feeling right, you need to let me know. But I might say, hey, let's push through it and see how you do, because I know that's more so what you're getting from the exercise versus something that might be going on internally that we don't really want to have during our session. So a lot of times I'll have patients with bone metastases referred to me, and they're always like, well, what can I do? What is safe? And I'm like, really? We can try whatever we can. That's what the literature says. It's just we just need to monitor for pain. And then, they're like, well, okay. And I always ask, can you differentiate your pain from soreness? And if they say yeah, then I'm like, cool. It's the golden ticket to start trying. And that's kind of my motto. Here, Pittsburgh is, I grew up in Pittsburgh. Pittsburgh's a big sports town. Mike Tomlin always has his saying, the standard is a standard, where mine is like, my motto is, I would rather try and find out that it's not going to work than never try at all and leave a door open or door closed for you that way too. So with any patient that comes through the door, I try and just really find out what they're trying to do, provide the right education about, hey, if it's painful, you need to let me know, but I'm trying to make you sore in a sense so that you can also feel something different. And let's try and really get you back to doing what you want to do, even if it might seem impossible. And 9 out of 10 people might say it's not going to happen. We're still going to try.
Well, I think that's the difference between going to the gym or doing activity alone or with somebody who's not a qualified healthcare practitioner versus someone like you where you're trained and it is medically supervised. So they have that extra guardrail in place to work with you to say, hey, something's not right. Let's see what's going on.
Yeah. And I feel like too, that's the one thing that I always, to a lot of my patients that come in, I always say I'm a glorified personal trainer in a sense, that way, where I am really just trying to get your confidence back with your activity and your mobility and your strength and endurance, and make you, give you the opportunity to have control of something. You've gone through, months where you're told to show up for treatment, get lab draws. This is something that you can control. You tell me what you want to work on. I'll develop a plan and a program, and we'll both kind of head down that road together. And for me, a lot of times it ends up with me working out with them. And, they do a set, I'll do a set while they rest. And that way I know they're getting a rest, and it almost becomes like they're working out with their friend at the gym that you see, these other people doing on a day-to-day basis.
Well, I've worked with trainers in the past, and it is very uncomfortable when you're running on the treadmill or doing some activity and they're just standing there watching.
Yeah.
Right. The tandem approach seems to be a little bit more comfortable in my
Yeah.
opinion. So why is movement so important when you're undergoing cancer treatment in particular?
I, again, I think it's the one aspect that, it's something that they can control. It gives them something that breaks up that monotony of sitting in a chair, being in a doctor's office. The biggest thing for me though, too, is like, if we look at their research, and, you can jump on Twitter, you can hit Google Scholar up. There is a lot of benefit to it. Looking at optimizing your performance status and your strength and your endurance while you're going through treatment can really help carry you through the treatment, potentially helping to impact how well you tolerate it and also hopefully not developing any potential negative side effects from whatever treatment you're getting, whether that's something with neurotoxicity, cardiotoxicity, muscle wasting of that nature too.
So what are your top recommendations when it comes to activity for individuals who maybe have just been recently diagnosed with cancer? Like what should they be doing to get started?
Well, that's a very good question. I think it into I'm going to be very kind of dance around the answer a little bit of that question because it is very person dependent. So somebody that hasn't ever been, hasn't ever exercised or doesn't really have any hobbies or activities that they do, it could be a little daunting for them to try and find something to start. But at the same token, there are resources out there in the hopefully in their community or out there in on Google or social media that they can find and connect and get some guidance that way. But also too, knowing that there are individuals, whether they're physical therapists or exercise physiologists, hopefully in their area or community that they can connect with that can help give guidance that way for them too. The biggest thing too is if you're starting from an area where um, you're so-called sedentary, you want to start small. You want to ensure that your medical team is okay with you starting to, just in case there are any potential complications or with comorbidities where they're concerned with you, getting your heart rate up, but also too for those individuals that are coming from an activity-based background, whether they were a frequent exerciser, played, in an adult league, or unfortunately they're diagnosed younger and play sports still competitively, just kind of testing the water and seeing what they can handle, knowing that each day is going to be different. They might not necessarily feel their best day to day, but as long as they can kind of gauge, how their body's feeling and where they're at and be active and, get their heart rate up a little bit, feel like they're getting some activity that they can control. I think that's the best thing for them just to, test the waters and see how they're doing when they start out. And then obviously, if they're able to progress, do a little bit more each week, look for new activities. It's always nice to, if they're up for it, learning different skills and activities that way too, just helps with kind of breaking up the monotony. My biggest thing is I hear it a lot and I totally understand it too. Not everybody wants to exercise. Not everybody's an exerciser. I've had patients come up to me that cringe at the thought of sweating. They're like, I've never exercised in my life. I've never sweat, but they enjoy walking outside. And I'm like, okay, well, what's the barriers to walking outside? What's the barriers to, going back to Zoom class or playing pickleball? And how can I help reduce those barriers and make you feel confident again? Um, Getting back out to that. Namely, like I had one person who was, they were a soccer player. They played in an adult soccer league and they were concerned about taking contact. Understandable. They just had major surgery, within the past year. They really haven't been active. I was like, all right, come take the ball from me, basically. So for, 10, 15 minutes, they just tried to steal the ball off of me and basically was just worked on taking contact and they felt, much better after that session. So it doesn't also have to look at just weights or lifting or exercising. It can be activity that way within our sessions as well too, or with the session with somebody you're working with or doing with your friends.
Very good. Well, thank you so much for sharing this information with us. I hope you've inspired our listeners to really just get out and move at whatever level that you're able to do so.
Yeah.
So, listeners, please visit fucancer.health to learn more. We do have a lot of exercise-related resources available for our members, and of course, there are free resources available for everyone as well. And be sure to like and follow the FU Cancer podcast wherever you access your favorite content. Until next time, I'm Christina Rollins. Thanks for listening.